Hello there, everybody. Nice to see you. So I'm Dr. Allie, and I'm here today to talk a little bit about another aspect of the Lifewave science. So today I'm going to go through one of the studies that have looked at Lifewave X39. And in this one, we've been looking at some using non-invasive scanning and subtle energy testings to look at the way the X39 patch works on the brain, and we've been using P3 brain mapping. So this is a study that Lifewave used. Was done in can't see when. Yeah, so these are just preliminary readings, and yeah. So interestingly, some of it's disappeared. Anyway, nice to see you online on YouTube today. So in this study, so with X39, this is a patch. Let me just show you what it looks like. You can see what it looks like on my upper chest there, just below my neck. And X39 is a patch that activates GHK-Cu copper peptide in the body, and that in turn helps to it activates our stem cells. So as we get older, our stem cells reduce. We have 1 billion when we are a baby, and it gradually reduces so that by the time we're 60, we're 90% depleted with our stem cells. Stem cells are active or inactive, and we want them to be as active as possible. The number of active ones is related to the our aging rate, so very important. Okay, sorry about that, just getting my head around this technology. So in this study, we were looking, see, this was a study done let me just scroll to the bottom. There's a lot of data in here, and I had hoped to be able to present, summarize it into a presentation, but I had to step into the breach and do a presentation over the last hour for one of our brand partners in their absence. Okay, so these are preliminary results, and I don't have the actual published paper, so I don't know what year it was and where it was published. It was a pilot project to use brain mapping. So it was using brain mapping to assess any difference in brain function after using Lifewave X39 for a 6-week period. And in this case, they looked at 12 healthy older adult participants before and then after 3 weeks, and then after 6 weeks of using the Lifewave X39 patches for 12 hours a day during the day. All the participants showed dramatic changes in their scalp topographic map. So these are the colored maps that I'm going to show you that looked at the amount of inflammation. So it was reporting the amplitude of the P300 recording for each channel, and also in their coherence map. So they were measuring brain coherence as well, which is a measure of how the energetic flow within the brain. So with these coherence maps, it showed that the majority of the participants started with an overactive brain, and their brain calmed down significantly after 3 weeks of wearing the X39 patch. Several participants reported various notable improvements, and most participants reported feeling slightly better or a lot better at the end of their participation. So even in a scientific study, we're seeing an improvement here. There was a statistically significant increase in physical reaction time at session 2 that may be due to the effect on the physiology of the participant. So there's a little bit of an increase in the reaction time, but then it returned to the initial average value after 6 weeks. So it's a temporary physiological effect while you're getting used to the X39. So So brain mapping measurements were performed on 12 healthy older adult participants at before 3 weeks and at 6 weeks. And in addition, they monitored mood and well-being levels using psychological tests, the brief mood introspection scale for mood, and the Arizona integrated outcome visual analog scale for well-being. And it was sponsored by Lifewave, so they provided the patches. And if you're in science, you know that may affect the outcome. And the participants were selected according to certain criteria. So they were between 50 and 80 years old with no mental disorder and no psychotropic medication, no cardiovascular or pulmonary conditions such as asthma or irregular heart, no prescribed medication within the 2 months prior to participation and during the study, no use of recreational drugs, cigarettes or vaping, no simultaneous participation in any other research product, no previous utilization of Lifewave X39, so there were people who'd never tried these before, and no consumption of alcohol within 48 hours of participation and for the duration of the study, no food, caffeine or other stimulants within 2 hours prior to participation, and agreed to wear the patch for 12 hours daily for 6 weeks. So I like visual, so I wanted to just share with you some of the visual results we're seeing here. So bear with me and I will see if I can share the screen. Right. So this is participant 1. She was a 77-year-old yoga instructor, so relatively fit, and she hadn't used X39 before. She was using the back of the neck as her site. This is one of the 2 main recommended sites that we use for putting the X39 on that prominent vertebra 7. And it showed that so she noticed that her morning exercises and meditation had greatly improved by the 3rd visit. And she was having vivid dreams during the experiment. I found that as soon as I started using the X39, I started having vivid dreams and remembering them. These are signs that you're sleeping to a deeper level, so you're getting better quality sleep. So you can see here that at the initial session before using X39, there's a lot of inflammation in the brain here. So these scalp topographical maps were computed from 19 EEG channels recorded by the brain mapping system. We're looking at the amplitude of the P300 recording for each channel in microvolts using a color coding scale presented at the right side. So this is your key. So red is the maximum amplitude and dark blue is the minimum amplitude. So it's rather than inflammation, it's hyperactivity of the brain. So during the study, her brain calmed down dramatically by the 2nd visit. And after wearing the X39 for 6 weeks, her brain remained calm in terms of the brain mapping that we're seeing here. So we're also looking at brain coherence and changes there. So I just want to scroll on to the next one. So the 2nd participant was a 67-year-old female manual therapist specializing in craniosacral and massage. So as a therapist, I think these 2 in particular would tend to have had a much healthier lifestyle than your average person. And I find that healthier people who are living a healthy lifestyle and already implementing many elements of a healthy functional medicine approach to health, you tend to find that they have less marked results with these things. So in this study, she was placing her patch 3 inches below the navel, which is the other main site that we suggest. And she found that on the 2nd visit, her well-being score was 57%, her mood was +5, and a 3rd final, it was 63%, and her BMS score was +8. So she felt slightly better than usual at all 3 visits in the overall wellness assessment. And on the scalp topography map, you can see that there's a lot of brain activity initially. So it's a maximum amplitude of 10 microvolts. And her brain was hyperactive. And then her brain calmed down dramatically at the second visit, which is at 3 weeks. And then after wearing it for 6 weeks, it's even calmer. So there's beginning to be some blue creeping in here that's allowing her brain to calm down. So then we go to 68-year-old woman who's a real estate broker. She has a history of high blood pressure with problems and pain in her bones, joints and muscles, and swelling of the ankles or lower extremities. And the entire duration of her participation, she placed her patch in the middle of the neck. So again, she was putting it on the back of the neck here. At her first visit, she indicated that her sense of well-being was 77%, with 100% being the best you have ever been. Second visit, it was down a bit, 57%, and her third visit was 63%. She indicated that overall she was able to work out harder, with more stamina, without muscle cramps, feeling better about workouts with less pain. And she also indicated that she was even more even-keeled, mentally alert, sharp, and that her skin is a little drier. Overall wellness assessment, slightly better than usual at the beginning of her participations and a lot better at the end of her participation. And again, you see a lot of brain activity at session 1, reduced at session 2, and still reduced at session 3. So again, we're looking at brain activity here, and this is a hyperactive brain, calmed down dramatically over the 3 and 6 weeks of the trial. I'll come back to you when I've had time to look through and understand the other results that they have here. The fourth participant is a 73-year-old male retired CPA, so accountant. And for the entire duration of his participation, he placed the patch 3 inches below the navel. So what we're doing here is getting consistency for the trial duration for those individuals. So his sense of well-being was 48% at the start, and it was 70% at 3 weeks and 20% at 6 weeks. And here you can see that the brain activity is very minor. He's not got a hyperactive brain like the other three trial participants we've looked at here. But there's a little bit of hyperactivity there. So what they're suggesting in their interpretation, definitely says it's male. Yeah, when he came in, his brain was hypoactive, except for the right frontal region here. And his brain became less active in the front right region, but a little more active overall at the second visit. And after 6 weeks, it's got more activity overall. Interesting, eh? Always wanted to know the background to the images that we're using in our standard presentation that we've just been doing. So participant 5 is a female 63-year-old pranic healer with a history of thyroid problems, treating with natural remedies, some shortness of breath with heavy activity, and a small skin cyst removed in the months before. For the entire duration of her participation, she placed the patch in the middle of the neck. And here again, we see that there's areas of hyperactivity. So when she came in, her brain shows high activity in the right hemisphere, low activity in the left hemisphere, calmed down at the second visit. And then after wearing the patch for 6 weeks, the brain was more active again. And those look much more intense than the previous study participants. But again, I haven't had time to review those elements. So participant 6 is a 58-year-old female tile setter with trigger finger on the middle finger of her left hand. And she was using the below the navel position for her patches. And you can see she's got a lot of hyperactivity at the frontal area of the brain. So her brain was hyperactive in the frontal lobes, remained active at the second visit, and started to calm down a bit after 6 weeks. So participant 7, this is a female 66-year-old sales associate, and she has a history of high blood pressure, but she's not taking any medication for that. And for the entire duration of the study, she was placing it below the navel. Overall wellness assessment indicated that she's feeling a lot better at her first visit, slightly better than usual at the second visit, and a lot better at the third and final visit. And in the initial scalp topographical map, it shows that she has a hyperactive brain, especially at the 2 temporal lobes and at the frontal lobe there. Her brain calmed down dramatically at the second visit and after 6 weeks as well. Amazing difference there. That's very marked. The 8th participant is a female 70-year-old Trade Joe's crew member, and she was using the back of the neck for her position for her patch. She was feeling a lot better than usual at all 3 of her visits, so even before applying the patch. And here we've got a little bit of overactivity at the frontal lobe of the brain, but generally it's hypoactive. So her brain was active mainly in the frontal lobes. Her brain shows very low activity at the second visit, very blank there. And after wearing it for 6 weeks, it became very active again. And then participant 9, this is a 63-year-old male realtor. So he had some shortness of breath on mild exertion. And for his study, he was using the below the navel position for his patches. So it doesn't really matter where you put it. We tend to use acupuncture points for the patches, but they do have a systemic effect. So the effects on the body work throughout the body, not just where you're putting the patch. So in these ones, we're seeing a lot of hyperactivity in the brain, which remained at the second visit, although slightly reduced here, and then much less at the 6 weeks. Then participant 10 is a male, 65-year-old male construction consultant and project manager with experiencing swelling of the ankles and lower extremities and problems in bones, joints, and muscles, and a history of diabetes or thyroid, kidney, or liver disease. This is obviously a questionnaire because they've not clarified what it was that he had. And he was using the back of the neck for his positioning. And then when you look at his topography map, his brain is more active in the right parietal region of the brain over here initially, became hyperactive across the whole brain by the second visit at 3 weeks. And then after wearing the X39 for 6 weeks, it's calmed down a bit again. So the patterns of brain activity were different too, with most activity in the middle and right parts of the brain here rather than the posterior part as shown in the initial one. Participant 11 is a 66-year-old female real estate office manager, and she was using the patch at the back of the neck and didn't have any particular symptoms during the trial, prior to the trial. And they show that when she came in, the right occipital region of the brain was hyperactive. Her brain became extremely hyperactive at the second visit, and then after wearing it for 6 weeks, the brain calmed down dramatically. And then participant 12, so the last participant's a 69-year-old male photographer with some pain in his bones, joints, or muscles. Again, questionnaire, so we don't know where. And he was placing it below his navel. So he indicated he had a bad cold for the last 7 days of the study, and not noticed any physiological or psychological change during the time of his participation. And what we show here is a lot of brain activity in the central area of the brain in session 1, before using the patch. Brain was hyperactive, calmed down dramatically at the second visit, and it remained within the normal activity range after wearing it for 6 weeks. So this is more normal with sort of areas rather than blank blue. You've got sort of a whole variety there of brain activity. So with the discussion, excuse me, they use statistical analysis there for discussion. So all participants showed dramatic changes in their scalp topographic maps, reporting the amplitude of the P300 recording for each channel. But it was very varied, wasn't it? So you can see there's a lot of variation between the individuals here. Statistically significant increase in the physical reaction time at session 2 may be due to the effect on the physiology of the participants. And it returned to the initial average value after 6 weeks, which suggests that your body gets used to that and returns to a normal level. So if there's an increase in reaction time, that's quite interesting. Not necessarily what you'd expect, but maybe the body's just calming down and managing to just reset itself. So in conclusion, all participants showed dramatic changes in their scalp topographic maps, reporting the amplitude of the P300 recording for each channel, and also in their coherence maps. Several participants reported notable improvements, and most reported feeling slightly better or a lot better at the end of their participation. There was a statistically significant increase in physical reaction time at session 2, which returned to normal at the 6 weeks. And the lower average values of P300 voltage at session 2 and at session 3, coupled with the coherence results, suggest that the initial voltage was high and reflects a hyperactive brain, which then is brought down to a normal level with the X39 patch, or in conjunction with the X39 patch. So there we have it. One is on the X39 patch, its preliminary results. I don't know whether they went on to look at that in more depth. It's mixed results. Certainly some changes there in brain function and in general well-being. This is Dr. Allie, the midlife medicine woman and the entrepreneur's menopause mentor and Lifewave patch brand partner. Nice to see you today, and I hope that was useful to you.